Hello and happy Friday. We're coming to you from the operating room because we want to talk about one of our favorite procedures to perform for patients, an upper eyelid lift, or what we call a blepharoplasty or a bleph. It's a great surgery, it's simple, it fits the niche that a lot of people are looking for, and it tends to be one of the earlier procedures that people would consider when they're talking about rejuvenation. It all starts during the consult, and during the consult, the surgeons are looking at other areas. We're looking at your brow, we're looking at your crow's feet, we're looking at your lower lid, we're looking at the cheek complex. So this area kind of is an evaluation all in and of itself. And so there are patients that might have thought, I just want to do an upper lid surgery, when in fact, they might be a brow lift candidate, or they might be where the lower lids are equally as bad. But you know, the nice thing is that if you keep this as just an upper eyelid procedure by itself, you can do this in a clinic, or in an operating room like this under local anesthesia. It's that simple. There are also clients that are a little bit nervous, and so if that's the case, we write a prescription for a sedation medication, and you just take that, and so then you're also just a little bit more relaxed, and they kind of cruise through the surgery too. A lot of them actually sleep during the surgery. So that's a great way to do it. Now, the way an upper eyelid is performed, and I guess measured if you want to think of it that way, is when you close your eyes, everybody has this little groove here called the supratarsal crease. And then when we're doing our planning, we mark that crease, we take a tweezer, and we pinch the skin above it to see how much of it is redundant. So we can essentially audition the surgery before we actually take it on. So we know then that it's safe and it's not overdone. From that point, we just numb the area, we remove the skin and the muscle underneath that, and then if somebody has a little bit of heaviness, some people will have some fatty deposits inside here, so we can take those out if we need to as well. But that's also gotten pretty conservative. We don't want to empty out people. We had been a little too aggressive with fat surgeries in maybe a decade or so prior. So that's also been a little more conservative. But anyway, when you close the incision, then it remakes this crease. And so the incision line hits in the crease where really essentially is disappearing. It's really hard to find. Very little pain afterwards. Usually bruising is the rate limiting factor, and that typically washes out in about a week or so. So again, very simple, very straightforward, nearly painless, quick, comfortable, and then the care afterwards is just ointment and some ice. So it's a really, really great surgery. Now, we often get asked, well, what about insurance? Will insurance take care of that? And there are cases when that will essentially be possible. But the problem happens to be that you have to have a fairly heavy skin fold, so much so that it typically is resting on your lash line. So we can look at that and say, yep, if you're hanging on your lashes, that's possible. But when you actually do a test, which is called a ptosis field, you actually have to then leave or lose about 30% or more of your vision for that to kick in. So it's a pretty high bar. So even though it's something that we definitely are looking for, and if there's any question, we'll suggest that you get that evaluation through an ophthalmology department. But if not, it's from a cosmetic point of view, really slick, very quick, very straightforward. So if you're in the market, if you're thinking about it, it's a really common surgery. Typically people start seeing things in their mid-40s that they don't like. And so you can very simply remove that extra skin and you get that bright, natural, kind of energetic look back. So it's a great surgery if anybody has any interest. And if you're thinking about it, just come on in and get a consult with your surgeon. It's a great choice. So hope you enjoy it.